Hi there, my name is Autumn Santilli, and I will be presenting on retinitis pigmentosa. So, an introduction to retinitis pigmentosa is that it is considered a group of disorders which produces a gradual loss of vision. It is a disease that is caused in the retina, in the cells, to break down slowly over time, which is what causes the gradual loss of vision. It is more of a collection of symptoms, but it is still considered its own disease. This genetic disease is in people that are born with it, so it would not be something that is caused due to too much exposure to light or any other type of disease that could degenerate the cells. The first sign that is reported is typically loss of night vision. Other symptoms that could be reported could include tunnel vision, loss of depth perception, photophobia, poor color separation, and eventually blindness. But again, it would first start off with people noticing that they have a loss of night vision. The epidemiology of retinitis pigmentosa is that there would be separated into a syndromic and non-syndromic, and that would depend on how many people would get affected. Most of the cases are considered non-syndromic, as that affects 1 in every 5,000 people worldwide, and that would mainly just involve vision loss in those cases. However, there is also syndromic, which affects 1.8 to 6.2 cases per 100,000 people worldwide. And this is when someone has vision loss and another symptom. So this occurs in conjunction with systemic disease. One syndrome is called Usher syndrome, and that's the most common form that involves a neurosensory hearing loss in association with the vision loss. So 20% of these cases are considered autosomal recessive, 10 to 20% of the cases are autosomal dominant, and 10% of cases are X-linked recessive. So these are typically found in females more compared to males. A diagnosis would occur after someone reports night vision disturbance, a gradual loss of peripheral vision, bone spicule pigmentation with vascular narrowing and optic disc pallor, failure during color vision assessment from districtopias, evaluation of fundoscopic and retinal function, and they would find abnormalities of retina. So some of these would just be told to a doctor, as this would be something that they have noticed themselves, but there are tests that can be done to prove these. For treatment, there is not a cure that has been found, so most treatments are just to help the symptoms and to prolong the symptoms as much as possible. So supplementation of vitamin A can slow retinal deterioration. Supplementation of CoQ10 can protect retina from oxidative damage. And there is also gene therapy that can try to help restore the damaged or missing genes that could have caused the symptoms. However, again, there's no cure, so these would be more to help alleviate or prolong the symptoms. The pathophysiology for this disease, again, would be that the patients that have this disease are born with it. Genetic mutations responsible for retinitis pigmentosa involve biochemical dysfunction that can affect the rod photoreceptors in the retina. So this is when the cones can succumb to a toxic growth environment created by progressive cell death in the retina, dyscrotopia or disturbance of color perception. Death of the rod photoreceptors create night blindness, which again would be one of the first symptoms people notice when they have this disease, and gradual diminution of peripheral vision and early signs of the disease. Defects may be associated with optosis, light damage, ciliary transport dysfunction, and endoplasmic reticulum stress. One of the natural product therapies that is recommended by doctors is vitamin A supplementation. Vitamin A itself is a fat-soluble vitamin deemed essential as it is important for visual phototransduction to help transform photons of light into electrical signals. Vitamin A helps with the promotion of cell growth in the retinas, and this is where it can help decrease symptoms of night blindness. Large quantities of vitamin A are in the form of 11-cis-retinol, and 11-cis-retinol are isomers that would translate into all trans-retinol and then get recycled back into the 11-cis-retinol to help promote the growth of those. The lack of the 11-cis-retinol chromosphere caused by genetic mutations are what lead to early onset retinal degeneration. Supplementation shows to bypass defective steps in visual cycle and can regenerate pigments that are necessary for vision. One study showed the effectiveness of vitamin A, fish oils, or both as a treatment for retinitis pigmentosa. Data was collected at the 1-year mark and at the 5-year follow-up. The data that they collected included the mean change from the baseline visual field, so this is where they would test their peripheral vision to see where they started off at versus where they ended after the treatments. Mean change from the baseline electroretinogram amplitudes, and anatomic changes measured by optical coherence tomography. 866 participants were included, which ranged from patients being 4 to 55 years old. 2 groups out of the 6 included taking the 15,000 IU of vitamin A daily. And again, this would have been up to the span of 5 years. Results showed participants receiving vitamin A had slower rate of decline in visual field area over the 4 years of treatment, so their peripheral vision did not deteriorate too much. And they also had significant protective effect on the annual mean change in cone ERG amplitude. Vitamin A cannot cure retinitis pigmentosa. However, it can slow down the progression of the disorder. Vitamin A can still be negative as it can have some side effects that can include liver damage, headaches, joint and bone pain, hair loss, and jaundice. Hypervitaminosis can be caused after consuming high amounts of vitamin A, which can cause dizziness, nosebleeds, nausea, thin hair, insomnia, and birth defects. Overall, when monitored by a doctor, vitamin A can be used safely to help reduce or delay symptoms from retinitis pigmentosa. Vitamin A can help slow the rate of visual decline. However, there needs to be more research in order to confirm long-term effects and benefits of vitamin A in patients with retinitis pigmentosa. Another natural product that can be helped in using for retinitis pigmentosa is CoQ10. CoQ10 is the coenzyme CoQ10, which is an antioxidant that aids cells in growth and maintenance. Levels of CoQ10 decrease by 40% as a person ages. This is the natural decrease in a person that doesn't have retinitis pigmentosa. So the level of CoQ10 would be significantly more for a person with retinitis pigmentosa. At least 12 genes are required for the biosynthesis of CoQ10. So if there are any mutations on any of the 12 genes that are required for the biosynthesis of CoQ10, this can be what can cause deficiencies and increase the body's susceptibility to degenerative disorders. Oxidative damage is critical in the death of photoreceptors, which can be hard to alleviate or prevent. CoQ10 inhibits microglia cell activation and maintain mitochondrial function, which can counter the effects of oxidative stress. CoQ10 protects mitochondrial membrane proteins and DNA from oxidative damage. A few different studies have experimented with CoQ10 supplementation to decrease retinal damage. These studies included participants having eye drops that contain CoQ10 in order to prevent degeneration of cones. The participants included donors who were younger than 30 years old receiving 42 nanomoles per gram of the CoQ10, or donors older than 80 years old receiving 24 nanomoles per gram of the CoQ10. Their CoQ10 levels were increased, which increased antioxidant ability and an increased rate of ATP synthesis in the retina. Coenzyme Q10 can still have side effects, which can include insomnia, fatigue, headaches, and dizziness. Overall, they can be beneficial for most people, including people that have conditions like heart disease, Parkinson's, diabetes, and people suffering from migraines. CoQ10 is a basic natural antioxidant to help maintain cells. It can be easily sourced from meat, fish, and nuts. And it helps protect retina from excessive oxidative stress to help reduce the symptoms occurring from retinal degenerative diseases, just like retinitis pigmentosa. Retinitis pigmentosa has no cure. The symptoms can be lessened or slowed down with the help of supplementation, just like vitamin A or CoQ10. Vitamin A can help slow down the rate of decline in visual field area. CoQ10 helps aid cell growth and development to keep the retinal cells last longer. Thank you so much for listening, and I hope you enjoy the rest of your day.